The Lane County Board of meeting, 26. Couple, Jess, Director Gray here.
Thank you. Appreciate the opportunity. This is a patient multiple objectives. Is that you know maybe a little more. We came and gave some detailed information on the financial situation and where we're from fund balance and balance perspective. Want to come and let you know where we are since then. And we have a lot of things within our local, state, and federal context that are all impacting our ability to remain financially sustainable. So you are aware, and we sent a press release out at the time that we did announce some layoffs in the CHC, but from our federal partners about whether there are other opportunities before the end of the federal fiscal year to get those appropriations into the hands of health centers. We certainly hope so. Our new patient revenue has been below our projections, and a lot of this is related to the churn in patients, so how many patients are dropping off while we're bringing new patients on. And there are also some different accounting mechanisms that are being used at the state level, where the CCO pays us about 1/3 of what we receive for Medicaid members. The state pays us the other 2/3 of our monthly payment in order to get to our full rate of payment. And there has been, we've done a lot of significant learning about how OHA does that assignment of the additional 2/3 of revenue, which has impacted our budget projections here. And then our encounter volumes are below expectations. We're working very hard on that. At this point, less than 5% reduction in volumes year over year, meaning from 25 to 26. But we are needing to do some more work to recover. In addition to all revenue pressures, as you know, the cost of is not going down. In accordance with we are continuing to see levels of medical supplies and equipment, and then just the normal every year of cost of living adjustment, increases in the cost of care. Picture is making it harder and harder to balance our budget. So although our early projections in the year were positive, we projected that we would break even this year for the 6 months of the fiscal year, because right early on in the fiscal year, and things were looking up until we've seen 4, but don't have a clear sense yet of how significant it will be for next year, is that as of January 1st, work requirements go into effect for the expansion population in Medicaid. So these are individuals aged 19 to 64, and there are a number of reasons that someone might be exempt from the work requirements. It particularly related to their medical frailty. It appears that the first time someone goes through redetermination with the new process, they will be able to self-attest to being medically frail and unable to work, which may mitigate the number of individuals who are then held accountable to work requirements who are not already working. And then the second time, because we will be on a 2-year redetermination cycle until the fall of 27, when we will go to every 6 months for redetermination. This is related to a Medicaid 1115 waiver that the state of Oregon has. The second time folks then are redetermined, they will need medical documentation of their medical frailty. The new rules that came out from CMS say that medical documentation cannot just be codes on a chart. It has to be an actual provider assessment of the disability level of the individual. We have tremendous trepidation around what documentation is going to be required, how much workload will this be for providers, how do we get every Medicaid member into a primary care provider at the interval that we need to in order to demonstrate continued disability. And none of these questions are yet answered. The state of Oregon has joined with, I believe, more than 20 other states in a lawsuit around this particular provision because of the administrative burden that is added in the assessment of someone's level of disability and whether or not that prevents them from working. But without intervention from the courts at this point, we are anticipating a very large increase in our provider workload without an increase in compensation associated with these changes. And difficulty with patient access. We know that that's a problem in our community. So monitoring this, we don't know how many people will actually fall off, though, for this coming fiscal year because of this self-attestation requirement. The other thing that we have learned that I think is worth mentioning just for any public that's watching, that's monitoring this, is there's largely been a statement that work requirements will be 80 hours per month, which it turns out is not entirely true. What is true is that if individuals make $580 in a month, they have met the work requirements.
Say that again, sorry?
$580 in a month.
If they've earned that?
That's correct. So in Lane County, our minimum wage is $15.55, as long as Google told me right. I believe that is correct.
As of July 1st?
As of July 1st.
Wow, okay.
Yes, so that would mean that Lane County members need to work just under 38 hours per month in order to meet the work requirements. If they are to meet the requirements by volunteerism or by education, my understanding is the 80-hour requirement will stand. So still trying to get more on this, but there's some nuance associated with how people meet the work requirements. And of course, that's minimum wage, but someone who has gig work or someone who's self-employed, you know, it would, ultimately it's the dollar amount that they're looking at.
Do we know, this is a little far afield, but I'm also thinking about a lot of people who are certified in-home care providers or caring for like a developmentally disabled adult child and they get some reimbursement. Does that count as income?
Yeah, it should count as income, and also it should count as an exemption. If you are caring for a disabled individual, that should be an exemption from the work requirements. So there are a lot of people who do this uncompensated, you know, caring for older adults, parents, that sort of thing, and that should count. Though we're still awaiting the actual criteria from the Oregon Health Authority. They found out recently what the federal rules were. There were many, many pages of those rules, as you can imagine. So OHA is working on getting greater clarity out to us. Okay, so back to the CHC. I'm kind of mixing in the big picture with the small picture here because it's all interrelated. But we've talked about many of these things that the reductions in our revenue really happened in the second half of the fiscal year. Then for next fiscal year, we had to annualize those, which was why we went from this smaller deficit to a much larger deficit, and these additional changes that we budgeted for that I've told you about We did make some changes that did have a positive impact, but it turned out not to be enough. So we are not just taking all of these revenue reductions lying down. We have some options for revenue enhancements. So we have already initiated with the state a process called a scope change request with Medicaid. This is essentially our way of renegotiating our Medicaid rates with the state. So we are engaged in that. Because we have not done this process in many years, we have some optimism that we could see a significant change to our rates, but we won't know until we go through the process. The timeline for that is that we will submit a proposed rate sometime this summer. Usually the final rate is within 3 to 5%, but it usually takes OHA about a year to decide where the final rate lands, though they will pay us back to October 1st for any of the rate changes. So October 1st will be our date where we would see any increases there. We are looking at some Medicare payment adjustments. We have some opportunity to take advantage of some federal rules that will give us more favorable reimbursement for Medicare and Medicare Advantage. We have engaged a consulting firm to come in and help us to make sure that all of our paperwork is in order and we're billing properly in order to get those enhanced rates.
Commissioner Ford.
A question on Medicare. You know, a number of times I've carried back to the national conference, and Commissioner Trieger carried it one time, the parity on Medicare payments. Did anything ever come of that between behavioral health and physical health?
Not yet. We're not fully there yet.
So that's
with
for
Medicare.
later discussion, but a glimmer of hope is on the horizon that maybe we'll get some relief there.
That's the hope. You know,
Everybody's in favor of it.
From a policy perspective, something that's very interesting is that the state of Oregon leaned heavily into parity with behavioral health and physical health. And when we leaned into parity, what that meant was that rates for behavioral health providers increased, access increased, utilization increased. And when you're looking at the analysis from CCOs, from the Medicaid Sustainability Work Group, they are largely pointing to behavioral health as what is driving the massive increases in cost in the system. And so potentially some of these recommendations involve looking at behavioral health for reductions. And we're seeing that also with new prior authorization requirements, new restrictions on utilization that are already happening in behavioral health. So it is an interesting question around how long and how hard will we be able to lean into parity? Would we ever be willing to look at the system as a whole and say, okay, the right thing to do is parity in behavioral health, but that means we need across the board changes, versus what is often the easier approach, which is, oh, the thing that's increasing is this, so we need to cut here. So we will have to engage pretty heavily in those conversations in legislative session, I think, as they're building that next biennial budget.
And there's an asterisk for future consideration.
Yes.
And we focused on Medicare because Medicaid typically follows Medicare. Okay.
And commercial insurers in particular.
Yeah.
Medicaid, we have more state control over. Commercial plans generally follow Medicare, and we have very little state control over those plans because most commercial plans fall under a category called ERISA plans, which are federally regulated, and we can't regulate them.
Thanks for that deviation from your presentation. I appreciate
Yes,
it.
of course. It's complicated. So we will be looking at our rate sizing, our number of commercial contracts as part of this process in order to enhance our revenue. We also are going to need to look at restricting the number of plans that we accept with new patients. So new patients who come in with plans that we are not contracted with, we are going to need to start setting up as self-pay if folks would like to be seen by us. Because what's happening is we're seeing folks on commercial plans, we're generating claims, we're getting denials. And that's costly for us to send those bills to get a denial. And then the patient either is responsible or can't afford to pay. Often we don't get any significant reimbursement for the care of these folks. The other thing that is a challenge for us is that if we are not contracted with the commercial insurance, we cannot make any referrals. They will be denied because we are not a preferred provider. But what is important to point out is that there are more and more patients in our community or residents of our community who can't afford the big health insurers that everybody contracts with. So we are seeing more and more kind of random one-off insurances that have, say, an $8,000 or a $10,000 deductible. The person, for all intents and purposes, is uninsured unless something totally catastrophic happens. But we then are in the situation of we're not contracted. No one in our community is really contracted. And then our referrals, everything becomes self-pay for this patient because the commercial insurer will not recognize the referrals that we send. So this is a growing population of individuals who appear to be insured, but for all intents and purposes are uninsured. And that's why we feel strongly that we need to set up reasonable rates for self-pay patients and maintain openness to being willing to accept folks as self-pay, because we can charge more reasonable rates for self-pay than we do for insurance companies.
And a lower administrative burden.
Yes, that's right. Okay, and then fee schedule adjustments, which you should be expecting to come to you in the coming months. The consultants that we have brought in to help us with our financials and revenue cycle are also looking at our fee schedule. Part of this will be making sure, so kind of the way that healthcare works is you set your fee schedule higher than your best payer will pay, because all of the insurance companies have contracts where they discount your bills, right? But we have to have that self-pay fee, because what happens in most of healthcare is that self-pay patients get charged that very high rate, and they don't have the power to discount that rate. So we want to make sure that we're taking care of residents of our community in a different way.
That's the thing that says provider write-off on your explanation of benefits.
Yes, exactly. Okay. And I should also mention, as a reminder, as a federally qualified health center, for anyone under 200% of the poverty level, we have a sliding fee scale, and for anyone under 100%, we have a nominal fee if for an individual who is uninsured. So we charge significantly lower rates for people in poverty if they are uninsured. Okay. So the way that we addressed our projected gap for next fiscal year, we identified $3 million in one-time revenue sources, which I am hopeful that all of this ongoing revenue work will offset that this won't actually be necessary to balance our budget, but as you know, we have to balance our budget. So we identified, again, it's interest earnings from fund balances and Lane County Treatment Center, primarily, that are making up this $3 million in one-time revenue. And then the remaining $3.5 million came from personnel reductions that were announced in June and will be implemented between now and September of this year. Okay, we've done a lot of conversation about this. This is not unique to the CHC. In addition to the Medicaid sustainability work groups, the governor put together a healthcare sustainability work group. So the Medicaid sustainability work group was run by Bruce Goldberg. John Kitzhaber is the one running the healthcare sustainability work group. And really talking about more broadly, it's not just the Medicaid system or the Medicaid reductions that are causing financial challenges for healthcare providers and the healthcare system. Former Governor Kitzhaber, the report from his committee is forthcoming, but he did do a blog post, which has started to be circulated with some of the thoughts and recommendations recommendations of the committee, really closely aligned, I think, to the Prosperity Council work that happened as well, to recognize that in the state of Oregon, we have a very high government payer mix. And because we have such a high percentage of people on Medicaid and Medicare, and a relatively low percentage of people on commercial insurance, the way that the system is set up is that government paying insurances pay less than the cost of doing business, and you make that up with your commercial payers. Because we have a small group, relatively small group, of individuals who are on commercial insurance, this drives up commercial rates, which then drives up out-of-pocket costs and employer costs for those in the commercial market. So, you all know that I am working on the Universal Health Plan, which is one mechanism that we could use to address this issue with payer mix. The other mechanism is economic development, really, so that we bring up that commercial payer mix, which would reduce the need to drive all of the costs to the commercial market, to employers, to employed individuals, in order to pay for the costs of the healthcare system.
So you mean basically job creation that give more people coverage, so there are more people covered by private insurance?
That's right.
Yeah.
Yeah.
Just making sure I was following what the economic development, what the
Yes.
connection was.
Because there are plenty of employed individuals who
Don't have coverage.
don't have coverage or rely on Medicaid.
Yeah, right.
So that is one component, and then a number of recommendations on at least the state of Oregon, if not West Coast Health Alliance, doing some large contracting to try to drive down prices within particularly pharmaceuticals, but there are other opportunities there, medical devices, supplies, equipment, that sort of thing. There are some other recommendations as well. I certainly encourage people to take a look at that blog post and the report when it comes out, because really it's the whole system that we have to be looking at when we're looking at the pressures on healthcare providers. We have seen the loss of Pacific Source, not just in the CCO market, but in the ACA market. Providence is now basically out of the insurance market. They were one of the insurers for the state, and they announced the need to exit. We have seen, that we have seen consolidations in healthcare, we've seen acquisitions, we've seen private equity come in. All of this is a symptom of a system that is struggling. So we are having to look at this broader, and I think it will be a big topic of conversation in session in 27.
And Eve, we'll be seeing Bruce Goldberg next week.
Yes, yes.
So a chance to talk directly with him about, Medicaid redesign at least. So.
That's right. And I had an opportunity, now that I'm on the Health Policy Board, to also hear from Christina Narayan and Bruce Goldberg.
And she'll be there too next week.
Yes,
So, yeah.
yes. So looking forward to continuing those dialogues.
And I'm looking forward to being a fly on the wall.
So our focus here is that, 30,000 residents of Lane County rely on us for their health care. And that is a huge obligation. We are very, very committed to maintaining care for the people we serve, and as we announced with the dental clinic expansion, as we're doing with the opioid treatment program in Florence, where we can in this environment, we will continue to grow and expand so that our residents are served. And contextually, it is harder every year. Okay. So here are some of the things that, we have done already. We have restructured our financial and revenue cycle oversight. We're working on filling schedules. Patient access is all we're talking about right now. It helps us financially. It helps us serve the 30,000 people who rely on us. We're focused on quality metrics because we do still receive some incentive payments. They seem to be dropping over time. The administrative burden and the cost of administering the programs to meet our quality metrics don't decrease, but the revenue that we have on the line to earn is decreasing, but we are continuing to try to maximize that. And then really our focus has to move into how do we keep our patients on Medicaid as much as possible, that no one drops off of Medicaid who should still qualify. That is a huge challenge, but still has to become the North Star for us. Again, better for not just our finances, but better for patients and our community and access to healthcare. Okay, I'm going to skip through some of this. This is just information on some of the reductions that we did make that were not personnel related. So we've not just looked at the personnel line item. Here is the actual impact of the positions that were announced. This went out in the press release, so it's already very public information. But we did have 23 positions that were impacted by our reductions. 15 of them have individuals in them. More than 15 people were impacted though, because as you know, with collective bargaining agreements, there's bumping that occurs. So we have worked through all of that. It appears that now 6 individuals have received formal layoff notices. We also, by contract, were required to eliminate 2 temporary and 1 extra help position as part of this process. So 9 people who were receiving income from Lane County who will no longer be employed by Lane County.
Commissioner Carr.
And a question on that, you mentioned collective bargaining and the bumping process, which is standard, I mean, you see it
Yes.
across the board. Is a presumption that the layoff notices have been to more recent employees? Typically, that's
Yes.
kind of the way it trickles, isn't it?
It is the lower seniority individuals who end up with the layoffs as long as the higher seniority person accepts the position that was offered. There is the option for the higher seniority person, if that is not a job that they want to do, there is an option for them to take the layoff. But for a lot of folks, working for the county makes the most sense.
Mm-hmm. Okay, good, thank you.
Did they have to work in that position before they could come down? Or
No, it's
some bumping rights, that's how?
yeah, it's within the classification. So, and in many cases, we use the same classifications to do very diverse work. So there are folks who could be bumped into a position that is completely different from the position that they are currently doing, but that's how it works, is just within that classification. Or we also have things that are called class series. So folks who are in higher level positions can bump people in lower, what's considered to be a more entry-level position. So they kind of define, you know, if you are part of these 4 classifications, you can bump your way down. So individuals who are in the most entry-level positions and the least senior are the ones who are most likely to be impacted in layoff situations.
That was fun.
And we don't experience situations, from my perspective, that has people who aren't qualified and or capable of handling the position that they're competency. That does not happen.
That's absolutely true. What does happen is it's like hiring a new employee, right? And so then there is the training and the onboarding in order to get someone fully up to speed.
Gotcha. It sounds like you have a little bit of leeway with your bumping though, which you can get creative.
Yes, I think it is fairly prescriptive, but we do. You know, we have a process that we go through, and it's been negotiated and agreed to, and I think that is ultimately the right thing to do, as that we come to agreement with our union about how this process works, and then we stick to it, and it is always a very emotional process.
Yeah.
Thanks, Chair. Director Gray, is this all this turmoil and budget cutting, is it creating any more conversation or creative ideas to the doctor pool to increase their patient pool?
You know, we are very, very focused on encounters, and to start with filling the schedules that we have. There is some kind of active bargaining that's happening on the other pieces, so I won't comment on that in public here, but we are very, very focused on patient access, getting patients in the door, making sure that we can serve our community today and in the future, and serve more people over time. So those are all things that we are very focused on. Okay. And then there's been some questions about this. Wanted to just make sure that we were calling out that over the course of the two major reductions in staffing that we've been through, one last fall, one just recently, we have emphasized that non-represented staff take a disproportionate share of the reductions. And so you can see that we are approaching 40% of our non-represented staff that we have eliminated their positions. That does make it harder for us to implement many of our quality improvement efforts. And so I think that it is important for us to recognize that there comes a point where you can't continue to make the improvements that you need operationally if you continue cutting non-represented staff. There is a reason that we are here, but we also want to make sure that we are keeping our bedside staff as much as possible. So you can see that approaching 20% in our represented staff positions.
As bumping occurs, did non-represented staff ever replace that there's a delineate the line there that does not get crossed? Okay.
Yes, non-represented staff have some limited recall rates to positions. I believe it's for 1 year and in the same classification in the same department, which is less of a broad recall rate than is written into our collective bargaining agreement, but we do try to take care of our non-reps as well.
I'm confident of that. Thank you.
Something interesting, there have been non-reps who have wanted to take represented positions, but of course in a time of reductions, those positions are open to current bargaining unit members and we may not be able to get the non-rep there. Okay, so again, this slide is just basically that we're focused on our community. We're going to do everything that we can. This is a tumultuous time, and it's not going to end in the very near future. So it is a very, very hard time for all of our staff and our leaders to be constantly trying to monitor and adapt. I would say that our systems are getting a lot better to help alert us early when the problems are happening. And there's just so much still that we cannot predict or that we do not know. So it's a difficult time to lead. But here we are. Our goal is to get to, at least the full 10% of Lane County that we're taking care of, because we have so many problems with access in our community. We have to continue our focus.
Okay, Commissioner Farr.
Thanks. Just generally speaking, this is a tremendous presentation that you put together. I'd seen some of the elements of it prior to this, but putting it together in terms that really are very easy for me as a layperson to understand, and put it in terms that really is going to be easy for me to talk about in terms that I understand, rather than talking above my head. But what was demonstrated is that you have sitting behind you have Katrina and you have Kate sitting behind you, that you and your team have done a superb job of managing internally how we handle things based upon circumstances that you have little or no control over, that are rained down upon you, some of which come from OHA. And with the recent changes in OHA, we can hope for maybe, Fair Boards is going to be the interim, and everybody has a good relationship with Fair Boards. But in the meantime, I just hope that when we are replacing OHA, and I'm talking upstream right now, that we find somebody as a new director of OHA with the skill level that this person has, and the understanding of the broad depth of how to serve that you have, Eve.
But not you.
I was just gonna
Right, someone who likes it, but not.
Somebody interrupted.
I was gonna say that too, it's okay.
You notice I
I'm not
said-
aspired for that role at this point.
Throw
in
him
my
a
life.
Snickers.
But seriously, somebody who understands what happens at the county level, because we are where it happens. And OHA hasn't always fully understood that. And you and Sejal had some little bit of, bump and roll in it from time to time. And I think Dr. Harthy was very competent, and we're moving in a good direction as Dr. Harthy steps away. And as we look internally, if I could talk to the governor personally about this, I'd say look for somebody who has county experience, who has depth of experience both in service and in administration, because that is how you know what is going on at the ground level. And that's how you make the best decisions.
Thank you. Yes, we will. I think it has long been a legislative priority for us that dollars flow to where the work occurs. Now, there are some instances where the work occurs at the state. They own the state hospital, for example. They handle the child welfare system, and we want to make sure that dollars are flowing to those areas as well. But any place that we can take away kind of the administration that requires 6,000 people to work in an agency and move those dollars to the community and to the people who need the service, I think that is ultimately beneficial to Oregonians. So I think that's long been the perspective of the board, and certainly hope that we will continue on that path.
It is a concept that Deming wrote about years ago that most people in this room haven't even heard of. It's called total quality management. Decision-making should happen or originate from where the work is being done. And that's what you demonstrate.
Thank you.
Yes.
Yeah, but I think to follow on to that and what you said, and you know this, we know this, but it's also important that when you mention the state hospital, because Lane County is the county that sends the most people there, because our system on the ground here is so inadequately resourced. It's not just about where the money flows, it's in fact, first and foremost, it's about who's being served and whether we're serving them early enough in their illness, whether it's a physical or a mental health condition. The earlier we serve them, the less expensive it is to care for them and the greater their quality of life and the less the burden on those more extreme need facilities like OSH. So that's the piece that we saw with the CAFA grant that we hope the new director of OHA makes a priority to work with Lane County specifically and that system in general to ensure counties have the resources we need to actually serve people here in their own homes early on in their illness in a way that really meets their need. That's the way to save the state money.
For sure.
And doing that will pay them for generations to come.
Please, sure.
Question. I've been reading several articles recently about the pending Medicaid, Medicare cuts that are coming to the states. And they're in the hundreds of millions of dollars projection. Is that incorporated into your projections here locally that you showed us with these numbers? And how does that affect us locally?
Yeah, so we will know more when we have a new biennial budget. My understanding is that the work of the Medicaid Sustainability Group was to cut $3 billion out of the biennial budget for Medicaid. So that is, I believe, the value that they're trying to achieve within whatever gets approved in the new budget. So there are really three ways that you can decrease cost in the system. You can reduce the number of people who are insured, which I think this governor has indicated that that is definitely not a pathway that she would like to go down for all the good reasons. You can reduce payments to providers, and we know that providers are already on the edge. You can reduce what is covered. So those are the levers that we largely have. Now there's this other red herring out there of administrative burden. where your providers could actually do more with less. If we address some of that, we have tried and tried and tried, and I don't know that we've made meaningful progress, but I continue to sit on committees where we are working really hard at this, because that becomes the best way to save money. The other three options are all really hard. So the report that came out has more savings in it than would be required. So they'll look, I think, to pick and choose amongst the options that are presented to get to the reduction target.
And are the main options certain things that will be covered or no longer covered?
That is amongst the sets of options. So they did call out within the report certain types of services that are optional benefits. So there are some benefits that are mandated by federal programming. There are other benefits that we offer within our Medicaid program that are optional that we've added as a state. So they're looking amongst those optional benefits to identify, could there be reductions? Maybe there are utilization maximums on those, so you don't cut them completely. Maybe you do cut them completely. All of these options were kind of just put on the table, but I would say that aside from some basic comments that we want to keep as many people insured and as many services available as possible and focus on administrative burden wherever we can, largely the decision making was left to the electeds to kind of take those recommendations and run with them.
And so that's part of the discussion in the next legislative session.
It will be a big part, yes. First rolled into the governor's proposed budget and then worked through the legislative process.
So I'll be eager to see what those are. I'm sure many will be controversial, given that there are probably a lot of services that people utilize now. And if they become uncovered, then they're on their own for paying for those services or not being able to afford them at all. And how that affects what we can treat them for is going to be a very hard conversation. So I'm glad you're in those conversations. And whatever we can do to ensure, again, the most people covered with the most services is going to be really important. Thank you for being there.
Yeah.
Well, with that uplifting presentation,
Eve, it was uplifting, it really was. And if you don't think so, I mean, what it does is, reality is what lowers blood pressure and gives a good shot of reality and knowing what to expect and knowing that we have some control over what we can expect. And that's what gave us today. Thank you.
I would just add also competency is very reassuring, and your competency is so abundantly clear as are the folks that work in the division, right? So that's what gives me reassurance.
And we do understand the struggles. I mean, we're understanding them as you're explaining them to us. And I love Commissioner Farr's confidence, and he might be able to pull it off. But your presentations are always very impressive, Director Gray. I mean, I don't want to say shooting from the hip, but no notes and, able to go down these questions that we ask and then come back to topic. It's impressive to watch. So thank you very much. But you're not going to OHA. You're here. You're here. Okay, thank you. That was perfect on time too. Is James coming in?
Yes, I'll grab that.
Okay, perfect. Yes.
What happened to that puppy you used to have?
We're back streaming, right?
he doesn't look much like a puppy anymore.
Just a glitch.
It's grown into his feet.
Yeah.
Sure.
Yeah. We always had labs on the farm and they were stocked.
Yeah, wait till.
Okay, next up, we have a report on our homeless system update, and is this gonna be you leading us off, James?
I'm gonna kick us off.
All right.
Joined by some guests today, so. Yeah, so thank you commissioners for having us back to give a quarterly update on the homeless system response. Pleased to be joined today by Victor Flores and Liz Levin. They are program staff that work directly on the wildfire survivor support program and then the homelessness diversion program. So they're each going to speak to those programs. First off, I'm going to give a quick update regarding next steps for the shelter RFP development process. So a follow-up from the meeting we had in June where we discussed the NAV Center and we took input and feedback from you all and have created a plan for developing that RFP. So we will be convening a work group of the Poverty and Homelessness Board actually next Tuesday, July 21st. So that group will be comprised of either PHB members themselves or someone they designate to represent them. We felt like that was the best way to garner input and feedback with the PHB being the advisory board to the commissioners for issues related to homelessness and poverty. Their knowledge and their involvement in the system felt really valuable. That group is going to meet every other week until July, and during that time period, we'll be looking at the shelter system as it is currently, identifying what's working, what maybe is not working or has been challenging. We'll look at data, and then we'll look at different shelter models to work to determine what shelter models we want to be in that RFP. That group also will engage with relevant community stakeholders. There are some members of our lived experience group league that are actually on the work group, but they will also work with other folks with lived experience, specifically folks living in shelters or who have lived in shelters. I think it's going to be critically important to hear directly from them. The plan then will be in October. I will return for a work session with you all related to the shelter RFP and the NAV Center River Avenue property and what we want to do with that property. And we'll provide the recommendations that this PHB work group has come up with to then get an RFP out in January of 2027. So that'll give us, that'll be an RFP, the providers would then start that following fiscal year, so July 1. So that'll give us 5 to 6 months, which is more time than we usually have with an RFP process, which will be valuable. It'll allow us, I think, to really create a thorough and robust RFP that will be developed with community engagement via that work group from the PHB. So looking forward to this process, and we'll be back in October or November, depending on when we can get on the agenda to provide those recommendations to you all. So at this point, I'll turn it over to Victor. Victor, as I said, works on various programs that support wildfire survivors, and he's going to provide you some information on those programs.
Thank you. And then
State partners. Yep.
Okay, perfect. Good morning. Happy to be here and present to you guys. I'll be talking today about Rebuilding Oregon's Housing Support Services. This has been the program that has been connecting households that were impacted by the wildfires of 2020 in Lane County with resources to get them back to a stable housing solution. Really quick agenda, I'll go over the 2020 wildfire impact, a little bit about ReOregon, the Housing Support Services general eligibility criteria, the services programs pathways available, a little bit of the program deep dives in terms of numbers, some of the Housing Support Services overall numbers, and then some of the program challenges and opportunities that we have identified as we take the program on the scores. Oregon's 2020 wildfires, as you may know, started back in September 7, 2020, which really spread rapidly through multiple counties. A total of 8 counties in Oregon were affected. Clackamas, Douglas, Jackson, Klamath, Lincoln Lynn, Marion County, and Lane County. In Lane County, the Holiday Farm Fire burned and threatened the communities of Blue River, Vida, Nimrod, Leeburg, along a 20-mile stretch of the Mackenzie River. That resulted in over 500 homes and many small businesses that were destroyed, and over 500 miles of electrical lines that were damaged, requiring nearly 40 miles of total replacement. The state's response to that was creating a program called ReOregon, established by Oregon Housing and Community Services under their Disaster Recovery and Resilience Division. $422 million in community development block grant disaster recovery funds was awarded to OHCS by the U.S. Department of Housing and Urban Development to take on this strategy. ReOregon is dedicated to restoring communities, rebuilding and enhancing resilience, and revitalizing economic stability. Lane County Human Services Division, we delivered the ReOregon Housing Support Services. Some of the general eligibility for the housing support services. Any applicants must have been affected by the wildfires and lived in an affected county. And then we also provide priority of service to those that are at that 120% of the area median income for their county. Under Housing Support Services program, there are 3 pathways that eligible applicants can participate in. We do the general screening, and then we also provide the services for the Immediate Housing Assistance Program, which provides eligible applicants with rent, utilities, pet deposits, rental deposits, moving costs, and then the rental and utilities assistance can be provided up to 24 months. The other pathway under Housing Support Services is the Down Payment Assistance Program, which that can offer up to $150,000 in available funds, and including closing costs as well for those interested in a home ownership pathway to be able to make that happen. Housing Counseling Services is another program pathway as well that provides guidance on financial and housing challenges that those that are currently renting or on a path to home ownership are experiencing. Just a quick update that IHA, Immediate Housing Assistance Program, did stop accepting new applications as of June 30th, 2026. However, active applicants and those that submitted an application before that deadline can still join the program and will receive that assistance that is available up to 24 months. The Down Payment Assistance and Housing Counseling Services programs, they continue to accept new applications, which we are the ones that receive that, and we screen those applications. A little bit of numbers for the Immediate Housing Assistance Program. In Lane County, as of June 24, 2026, we have assisted a total of 13 households. 8 are actively receiving assistance and working on their housing stabilization plan to reach some sort of housing stability. 2 are currently in housing navigation status. That is a period where they became eligible for the program, and we're working on either helping them transition into a rental apartment that meets their needs and is able to pass the inspection, so then we're able to provide them with the assistance. 3 participants have exited the program successfully, meaning that they moved into their long-term housing solution. Most of them moved into the Blue River community again with the home that was rebuilt by the HEART program. In terms of dollars spent on assistance, a total of $177,759 has been paid in rent and utilities assistance since the program became available on January 1st, 2025. Little bit of numbers for the Down Payment Assistance Program. In collaboration with Dev Northwest, that is the organization that is also delivering services for down payment assistance, 33 total households have been assisted by Dev Northwest here locally. 20 of those referrals from Lane County, and then 13 has been referrals from other counties as well. Down payment assistance in Lane County. We were the first county to close with the down payment assistance program and an applicant. 2 have closed so far, and a total of $300,000 have been paid out to make homeownership possible for 2 of those eligible applicants. An additional $6,000 was provided in closing costs to minimize that gap and make homeownership happen for that one applicant. Out of the other referrals, 5 other eligible applicants have already received a pre-award letter. That is the exciting period as applicants can then start doing the home buying process or start doing the home shopping. That's where, they get really excited. And this was as of June 2026. It is my understanding that we have potentially more pre-approvals already in place. So once a pre-approval letter is in place, then those funds are then held for those eligible applicants. And as of June 26, 2026, $750,000 is currently on hold for those applicants. In collaboration with Dev Northwest, there's a 3-year goal to allocate DPA awards to 14 households in the total amount of $2.1 million. Housing Counseling Services. This is a program that is available to all applicants as a standalone services for wildfire survivors who want to work towards housing stability, improve their credit, take a deep dive and strengthen their budget and skills, and become ready to purchase a home. It is a requirement also for the down payment assistance program. So those that go through that pathway, they also get diverted to complete a housing counseling session and complete a home ownership buyer's ready class. And Housing Counseling Services has served 9 Lane County residents. Overall numbers, 30 households in Lane County have been provided with eligible services, including rental assistance, utility assistance, housing navigation, case management, and referrals to Dev Northwest. 49 applications received as of June 24, 2026. 45 applications have been completely screened and an eligibility determination has been made. 32 were eligible, 13 were ineligible applicants. 4 applications are still under review, with IHA coming to an end to take new applications on June 30th. Most of the applications that we received in June were for IHA programs. 2 households awarded $150,000 each for down payment on their new home, and then 5 more were pending. A little bit about the challenges and opportunities from the program. Some of the challenges that we have heard from the many applicants that we have received is that the application, it's only available through Oregon Housing Community Services as a 64-page application in PDF format only.
It's ridiculous.
Wow.
So ridiculous.
Those with technology barriers or no access to a computer or anything like that, it's definitely was a challenge. My way of overcoming that challenge was setting up in-person appointments or meeting the customer where they were at. The applicant where they were at, and filling it out with them, right? I definitely try to remove that initial barrier or initial wall for these applicants, and then help them move forward as soon as possible to get an application in. The other big challenge too was providing property loss or proving property loss from 5 years ago. Upriver, many folks had different living housing situations, or agreements with landlords, and oftentimes folks that lost everything, it was difficult to carry, the most important documents that in the near future or in the future they were going to need to provide proof that they were living in there. So we became very creative in ways to meet those standards from OHCS to make sure that we were still bringing them into the program, even with some, where some documents were not fully met. The other also challenge was the duplication of benefits review. A lot of folks received FEMA rental assistance, and that is a fund that is duplicative to the funds that we're also providing. Those that received $25,000 worth of FEMA rental assistance, we just have to go through a little bit of a longer process to ensure that those funds were used appropriately towards actual rent, so then we can continue to provide them with rent in our program as well. Another challenge too, identifying wildfire survivors who were still needing assistance. We went ahead and tackled that by doing outreach, in-person outreach, joining on meetings that were specifically working with the affected population groups. And then we also work with a lot of the important organizations upriver to build a strong referral process and have them send us over applicants. Some of the opportunities, applications are still accepted for housing support services and actively screening applicants, and specifically for the down payment assistance and then housing counseling services. We have a strong partnership with Dev Northwest, McKinsey Long-Term Recovery Group, McKinsey Community Land Trust, and Oregon Housing and Community Services. And the IHA program, as I mentioned, will stop accepting applications as of June 30, 2025. Both new and current eligible applicants will still continue to receive assistance up to 24 months. And with that comes the end of my presentation.
Yeah, so piggybacking just off of the wildfire support programs, I wanted to give an update on the Lazy Days project, and pleased, well, let me go backwards here. I think most folks in the room are familiar with Lazy Days, but this is the project that was a partnership between Lane County Homes for Good and the Oregon Housing and Community Services to rebuild the Lazy Days RV park up the McKenzie River. The priority population for this project was folks that were residing at Lazy Days in 2020 at the time of the fire. And I'm pleased to share that as of this month, all 30 units up there have identified tenants. So they haven't all moved in. They're, you know, to Victor's slide about paperwork, there's a lot of paperwork involved, bureaucracy. And so all of the households are either moved in or they are going to be moved in by the end of July. So we're really excited about that. It's comprised of 9 households with children, 21 adult-only households. 10 of those households will be owners of the property they will be living in, and then 20 will be renters. As I mentioned, the priority population was for folks that were residing at Lazy Days. Because we are now almost 6 years out from the fire, it was a challenge to find a lot of the folks that were living there. They obviously were displaced, and some of them moved out of the community. In conversations, you know, I've been privy to, there were a lot of folks who were so traumatized by the experience that they didn't want to continue living upriver, understandably. And so we are only seeing 3 of the 30 units being folks that lived on the site. That being said, 90% of the residents are folks that were living in the McKenzie River community at the time of the fire. The remaining 10% are folks who are otherwise eligible, so folks that were experiencing homelessness and met the income criteria. So, you know, I think it's exciting that, you know, so many of them are folks that were directly affected by the fire. And I do want to specifically also just shout out the McKenzie Valley Long-Term Recovery Group. They were an incredible partner in this process, especially when we, you know, talk about how challenging it was to find survivors and to find folks. That group really has built such a strong community up there that they really were to help. They really helped with the outreach for us to be able to reach folks. So we're really excited to see this project finally come to an end, because it's, as you know, been a long time coming. So we're really excited about that. So
if you don't mind,
please.
I think just big picture, one thing that's exciting is that we finally have been able to situate ourselves through the Human Services Division as a hub for the different programming that's available within our community for the wildfire survivors. And that has been needed for a very long time. And so very much to Victor's credit and his strong collaborative approach, client-centered approach, we really feel like we've been able to streamline and coordinate resources in a way that takes the onus off of the community members. And so we continue to have that focus as we move forward. We're fortunate in that we'll continue to receive community development block grant disaster relief funds going into the next fiscal year, and are expecting an even greater investment from Oregon Housing and Community Services to continue with this coordination and client-centered approach. So exciting to be moving in that direction. It's taken a long time, as you are all very aware, but do appreciate that Oregon Housing and Community Services continues to take our feedback and provide additional investments to Lane County, the government, as well as the programs that are actually serving people within our community.
For sure.
Does that include, thank you for that, and thank you, Victor, for what you've done to help people. I think, you know, we were talking before about healthcare and administrative burden, and we as a culture often talk about administrative burden as it relates to businesses and so on, and we're supposed to be immediately sympathetic and do everything we can to relieve that burden. But here we are imposing administrative burden on individuals who are the most in need, the most vulnerable, and the least resourced to bear that burden. So thank you for what you've done to help with that. Does some of that advocacy and that collaboration with OHCS include, like, have they been receptive to feedback about a 64-page PDF electronic-only application, and are they actively working to streamline that?
they've certainly heard that feedback. I will say that community development block grant funding, whether it's disaster relief or just, for economic development, is one of the most challenging programs to work from due to all of the rules and regulations that are a part of it. And so when you take this structure and then you lay it upon disaster recovery, you get a 64-page application. And so I think I know that Oregon Housing and Community Services has provided that feedback to the federal level, but that is congressional change that would have to occur. And so it's a long process that may or may not change during this effort.
So some of us are happy to do some direct communication with our congressional delegation about that issue so they understand how that's playing out for their constituents here on the ground.
That's great, thank you.
To add to K2, also a strategy that we implemented was just like we created an interest form and we shared that with our community partners and then asked them to include a little bit of screening on their intakes as well, intake processes. If they had someone who talked about being wildfire displaced or wildfire affected, they could go into our interest form and submit one where it was not asking all the questions in the application, and that created, or minimized that burden of administrative processes initially, and it allowed me to connect with them right away, and then do a screening over the phone, and then connect with them to actually do the application. So that was very helpful as it, stopped deterring people from taking a look at a 64-page application and said, I don't want to do that. Instead, they still went ahead and sent over a referral, we connected with them, and then we moved forward in the way that makes sense.
Well, it can be done, and Commissioner Farr probably remembers this back in the day when the Oregon Hunger Relief Task Force was very active, and we had
Patty
a
Whitney
food
was.
stamp outreach. That's right. We had a food stamp outreach steering committee that I served on with Cassandra Garrison, if you remember that name. It's a blast from the past. And the initial application to apply for food stamps, what's now SNAP, was 11 or some pages, and we worked with congressional representatives to get that and our state agency reduced to a 2-page application.
That's great.
And what do you know? More people began accessing that benefit and feeding their families and spending their food stamp dollars in local stores, and it actually worked. So it can be done.
So pivoting.
Hold on.
Please go for it.
I had a question.
I just want to add to that, there are so many ways recovery could be done so much better in the future. We've got years now of trying to process funding from the federal and state level that is, in many cases, some of the most administratively burdensome ways in which to do work in our community. And it's important for us to continue to give feedback because this is likely not the only disaster that's ever going to come across our state and our county. And there are forums in which we're giving feedback to the state agencies and the governor's office to ensure that many of the burdens can be eliminated in the future. The frustration is we need to ensure that those state agencies are meeting us and taking that into consideration in future. We've struggled with that, and we continue to struggle with that. We appreciate the people that work there and our partners, but they are looking out for risk. They don't want any of this money to be clawed back after the fact. We don't want money that's granted to the county to be clawed back after the fact. But looking at that risk creates the administrative burden. And that doesn't do wildfire victims any help. So I remain engaged in those conversations. I think our staff has remained engaged in those conversations. It is going to be a long-term conversation for the state of Oregon as we see disasters in our state. And we have other states that we can look to that have been able to streamline this. A lot of the southern states, although they see different kinds of disasters, we can learn from because they have really perfected this system. But we need the assistance of our state and federal partners.
All right, so changing gears here a little bit, I want to give a brief overview of this year's point in time count. There was a press release released, I think, about 2 to 3 weeks ago now that provided some detail, but I want to go a little bit more in depth around the results that we saw from that as well. So just as a reminder, the point in time count, or the PIT count, is a requirement of HUD for continuum of care. Every 2 years, they must do a full point in time count, which includes utilizing HMIS, or Homeless Management Information Data, and the HBNL, the Homelessness by Name list, paired with in-person surveying by street outreach teams of folks that are unsheltered. 2026 was an off year in that we did that full count in 2025. So this year we did not need to do the in-person surveying to supplement the HMIS data. We were able to just use that HMIS data to get the information that we needed. So this year we're seeing a slight decrease in the number of folks experiencing homelessness. It was a decrease of 7.5% on the HBNL. Going back to the HBNL, that is data that is pulled from over 30 providers across Lane County who provide services. When folks come to access those services, they are entered into HMIS, and if they report being sheltered or unsheltered at that time, they would be encapsulated in this data. You know, as you may recall, the point in time count, the in-person surveying historically has been on one day in January. With this data, we were able to pull the HBNL data for the full month of January, and so I think that gave us probably a little bit better of a picture. We do consistently see, and HUD has recognized the robustness of our HMIS system, in that when we do the surveying of folks, we're still seeing that 98% or more of those folks are already in the HMIS system. So I think, well, I know the HMIS system is really successful in accounting for the vast majority of folks experiencing homelessness in our community.
And just for clarity, when you say 30 places, those are any kind of service touch point. It's not just shelters, or so food box, or
Correct.
a medical program, or a...
Exactly. Food boxes, day access centers, shelters, it runs the gamut. So, as I mentioned, this year we saw a decrease of 7.5% from 2025. The majority of those folks, over 3,000, are unsheltered in our community. The balance is sheltered. I think that obviously is indicative of the number of shelter beds that we have available in our community. We continue to see there was a slight decrease in chronically homeless individuals this year, but we do continue to see a high percentage of folks in our community meeting that chronically homeless definition, roughly 45%. And then continue to see a high number of folks who have at least one disability. So 63% of the folks experiencing homelessness reported having at least one disability. As is seen across the country, we also see an overrepresentation of BIPOC folks in our homeless system. We know nationwide that BIPOC folks experience homelessness at higher rates than other populations. Lane County has a 21.1% BIPOC population. We see 25% BIPOC folks that are represented within the homelessness system in our community. With this reduction, we looked into the reasons that we think we have seen that reduction this year. I think the continued investment in programming, specifically, and Liz is going to speak to the diversion program. We really feel like diversion has made a big impact in our system. It's a light touch intervention that really has been able to assist a high number of folks with getting housed. We also this year saw the opening of the Bob, which was a new permanent supportive housing project, which would play a role in that. And I think the unknown piece is how many folks are having their homelessness prevented through homelessness prevention and rent assistance funding, and so that is a continued factor in helping to keep folks housed. So when we next year do the full PIT count, the in-person surveying as well as the HMIS data, it'll be interesting to see the outcome of that, and will help us, I think, to further identify the intervention interventions that are really critical to keeping folks, to getting folks housed as quickly as possible. With that, we're going to move into diversion. I'm going to cover the first couple slides, which are just a refresher of what our homelessness diversion program is.
Commissioner Farr, the question.
James, ever so quickly, I'm going to shine a light on something, that if anybody's eager for more information, our dashboard, Homelessness in Lane County, is tremendous volumes of information, very easy to access, including frequently asked questions that I get asked from time to time, and it's easy for me to answer them because it's what is HMIS? Well, here's the answer right here. And sheltered versus unsheltered? Well, here's the answer right here. So all of the questions, you anticipate questions before people ask them, which makes it easy for us as commissioners to answer the questions. We don't need to make stuff up and we can all talk from the same page because it here is right here on the page that you all have created.
Yeah, and that dashboard, it gives us in the moment. It's not just the January data. It can give us that moment throughout the year or throughout a time period.
Thanks for that addition. That's a frequently asked question is how often is this updated? Well, today.
Thank you for mentioning that. So our homelessness diversion program is really rooted, it's a nationally used best practice model. It's really rooted in what's called a housing problem solving conversation. So it's recognizing that folks that are experiencing a housing crisis are in crisis, and with that comes the fight or flight response and the not necessarily thinking clearly about what resources may be available to them. And so through diversion and through that housing problem conversation process, trained points of access in our system are able to work with households to try to identify resources that may be available to them. That can be connections within their social network, employers or coworkers or just things that they maybe in that moment haven't fully explored. Sometimes that also means pairing with flexible funds, but not always. Sometimes it's just that conversation and someone remembers, oh, my aunt who lives in Washington said I could stay with her whenever I needed to, and then they're able to do that. But sometimes it's just needing a little bit of funding to be able to pay an application fee or pay a deposit, or what we've been seeing recently, which Liz is going to touch on, is helping to connect folks that are in treatment to sober living. That's been something we've really increased in the last year and are excited about. So that's the model, is really this client-centered, client-focused, light-touch intervention to try to get folks as quickly out of homelessness and into housing as possible. It is not going to be an intervention that's going to work for everyone. We talk about it being a tool in the tool belt paired with all of the other interventions that we use. But it is an alternative to a household having to enter into emergency shelter. If we're able to divert someone, which is where the name comes from, into housing and not into an emergency shelter, that means that shelter bed will remain open for someone who may not have those other resources. But because of that, it's not a model that will work for everyone. We generally see folks with significantly higher barriers or higher needs, not always, but may not be served adequately by diversion. They may need more long-term assistance. Diversion really is just at its core one-time assistance. It's not going to be that ongoing case management support that you see like through permanent supportive housing. So for those folks, they may need that more intensive programming. But as Liz will share with the data, we are really seeing a lot of success for folks that just have that kind of in-the-moment barrier that's keeping them from exiting homelessness and getting into housing. This graphic shows kind of the flow of how diversion works within our larger homelessness service system. So when someone shows up at one of the 30+ programs we were just talking about and is seeking services, and they identify experiencing homelessness, we have trained staff, we just had a training a couple weeks ago, on housing problem solving. So they know that the first conversation that they should be having after they've addressed immediate needs around food and hygiene items and that kind of stuff is having that housing problem solving conversation. And so they're looking to see, is there somewhere we can connect you to housing today, tomorrow, in the near future by addressing whatever the barrier is. Like I said, sometimes it's financial, sometimes it's I'm scared to call my mom because I don't want her to know I'm homeless, but I think she'd let me stay there. And sometimes staff can help with those conversations as well. Hopefully then folks are able to be diverted from the system and exit into permanent housing. If not, then we are then moving to the next step in the process, which is our front door assessment process. And so trained assessors are assessing folks for vulnerability, and our system is prioritizing those folks with highest vulnerability for referral to either rapid rehousing, permanent supportive housing, or the long-term rent assistance program. So we're really trying to resolve that person's homelessness with the lightest touches possible throughout the system. It's what's referred to as a phased assessment approach. So we're not doing that front door assessment with everyone. We are reserving that for the folks that we have already tried to utilize diversion as a resource for them. With that, I will stop talking and turn it over to Liz, who will share the details.
If I may, I'm eager to hear what Liz has to present, but you don't blow your own horn nearly loud enough. And Kate, you're sitting there very, very quiet. Diversion, to me, is one of the greatest things that's ever happened in the state of Oregon in terms of addressing the intensity of homelessness, keeping people from homelessness. And I remember when we first started pushing it forward was during the MAC, the Multi-Agency Collaborative. We started talking about that. You identified that diversion seems to be working, and it seems to cost about this much compared to this much. And we became a model for the entire state using the diversion program, and in conversation directly with the governor herself, identifying diversion as really the greatest effective tool for using the dollars that were available. And we became, again, a model for the state in terms of the state's multi-agency collaboratives. It lives on to this day, and Liz, you're going to present how great we are in Lane County. And I really want everybody here and listening to understand the tremendous, insightful, foresighted work that you all did to get us to this point. It is, my heart beats loud just thinking about it. So I'm excited to hear you, Liz.
Thank you, Commissioner Burke. Yes, it is a great program. It's very exciting. It serves, so this past year, there's actually an error that's May 26th of 2026. From July 1 of 25 to May 26. We served 667 total households. Household can be comprised of a single individual or a group of adults or family with children. So we made, the model that we operate under is what's called a progressive engagement model. What that means is that we work with each individual household to identify what the specific barriers are for those households. So for one household, it may be that they have identified a rental, they have put down a hold deposit on that rental, but they need assistance to come up with the remaining deposit and first month's rent. And so we work with them to support them in that way. For another household, it may be that they have put down the complete deposit, but they need assistance with that first month rent. So it really is a very individualized program working with the specific barriers that each household is experiencing. We serve folks who are experiencing unsheltered homelessness or living in either an alternative shelter or an emergency shelter in our community, or folks fleeing domestic violence. So those are the three categories of eligibility that we work with. As you can see, there are many types of payments that we make in this program, and those numbers won't match the household because some households get multiple payments. So some households will get a security deposit as well as assistance with moving costs. Or some households may get a utility payment only. Their only barrier may be that they need assistance with getting a deposit taken care of with eWeb so they can get their power connected. So it really is a unique program designed to work with that specific individual. space bar. Okay, got it. In terms of cost effectiveness, it is incredibly cost effective. We average about $1,783 per household. In terms of sustainability, according to HMIS data, when we look at folks re-accessing services, at 6 months, 88.5% of the households that we have rehoused remain housed. They've not re-accessed services. Sorry, my brain just went blank.
They just haven't shown back up on the.
Thank you.
That list we were talking about, they have not re-accessed as identifying as homeless.
Thank you. And at 12 months, 81% have remained housed. So those are pretty good numbers, high success rates, considering that all we are taking care of is those initial payments. They go forth and are responsible for maintaining housing on their own after that. In terms of race and ethnicity, as you can see by the graphic on the homeless by name list, BIPOC folks represent about 28%. On front door assessments, 28.8%. And in diversion, it's 36.79% of folks that we serve identify as BIPOC. So because of our program is easily accessed, we really work to keep the program simple, where folks are, the paperwork is minimal. It's what's required in order to, by the funding, by Oregon Housing and Community Services under the Oregon Rehousing Initiative. That makes it easily accessible by folks. And we really think that helps to increase the overall ability for people to connect with our program and meet those. Also, because it is creative and folks, it's very client-centered, it's not narrow in the sense of you have to go with a specific property management. Shared housing is a huge part of what we encourage folks to explore. So provided that someone has the right to rent the property and can demonstrate that, we can make a payment. So if someone has a family member that they can be added onto the lease with, or they can get permission from the owner to move them in, we can help them with that rent payment. And I think that really expands out the opportunities for that shared housing for folks. This is the part that I'm really excited about, that I've put a lot of time and energy into, which is building up this community partners and access points. So within our homeless service system, oftentimes for coordinated entry access points, it's through very specific homeless service providers. In diversion, I've worked really hard to create partnerships with many different behavioral health providers. So I've worked to create relationships with peer support services such as Restored Connections Peer Center, with various treatment providers such as Willamette Family Treatment, Serenity Lane, Emergence, which with Emergence that brings in the cross-section of folks who are participating in drug court. So we have this intersection of folks who are experiencing homelessness, they're involved in the criminal justice system, they're mandated to treatment, and they're getting supportive services to get into housing. So it really is this sort of full circle experience where all of these different systems are coming together to support people into moving into housing. Deflection, I've been working to build a relationship with the navigators in the deflection team, and work so that as folks are being brought into that emergency shelter and the deflection team is working with them, that our program can support them in moving into housing, because that is part of their graduation requirements. Moving forward, we're going to continue to explore other community partnerships that we can build, broaden out. We have McKinney-Vento, so the folks working in schools with families. So there's all of these different access points that are non-traditional access points that have begun to flow into this program, which is very, very exciting. And have just increased the opportunity for folks to receive this assistance over time. Very exciting.
And I would just add the ability to get folks into sober living has been critical. Obviously, if someone is in treatment and not housed, the likelihood of them being successful in remaining sober or even remaining in treatment is unlikely. And so we've heard from a lot of these providers how critical it is that Diversion is able to work with them to get folks that they are working with in treatment into sober living. And as we can see by the data, they're successful after they go through sober living.
Yeah, so speaking of sober living, about 35% of our housing destinations are to sober living. I think sober living does not get enough recognition as an affordable housing for people that are interested in it and for whom it is a good match. It is shared housing in which one housing unit can be occupied by multiple people. So it creates density and is affordable for people who are working to rebuild their life. And it's I've had the lovely experience of having housing contracts come back signed by people that I rehoused a year ago. So that's a cool experience for me to see folks sit there and still living in that housing, and supporting other folks coming into that housing. So 21 deflection participants have been provided diversion assistance as of 5/26/26 over that fiscal year, and we hope to continue to support that program. Moving forward, so it's just been me in this program. Moving forward, we are adding additional staff, hooray! Which means that we're going to be able to increase capacity. We've also worked to expand some training in our community so we can build out even further those partnerships. We altered the way that we've been doing referrals so that providers can have more access throughout the week. When it was just me, it was one time a week that the referral portal was open. Now it's open 4 days a week. So all of this is really exciting changes that are coming this fiscal year. Yeah, we're going to continue to work to build these access points out and strengthen these connections, specifically with behavioral health providers, because that intersection between behavioral health and homelessness is powerful. We know that. We know that there's a tie-in there, and so sometimes folks are seeking behavioral health support, but they're not necessarily seeking housing support, but those behavioral health providers are doing the housing work. And so if we can get them connected in with this as a resource, then we can get folks housed along with their support system and their behavioral health support system. So this is just a testimonial from Chad Landerking. He owns one of the sober living houses that we work closely with. Well, he owns multiple sober living houses. So he shared that he's seen firsthand the incredible impact that the Lane County Diversion Funding has had on individuals battling addiction and alcoholism. Simply put, the funding has given people an opportunity to regain their lives. It places people into a safe, structured, supportive, and accountable environment where recovery can truly begin. Given the right support and opportunity, many go on to secure employment, reconnect with their families, obtain stable housing, and become productive members of our community.
Awesome. Recognizing we're close to time, I have one other item that'll probably take me about 5 minutes if you want me to go ahead, or I can
go ahead.
add it. Okay. So
We're on a
Built
roll.
for Zero, some of you may be familiar with that term. Built for Zero was created by Community Solutions, which is a nationally known entity that works in the areas of homelessness. And Built for Zero is a model that they encourage communities to use. And Lane County has been using pieces of Built for Zero for several years now, but really in the last year, we've aligned it with the PHB strategic plan goal of utilizing that model to see a reduction in chronically homeless families in our community. So the model is kind of 3 parts. It's ensuring that you have enough housing in a community, and specifically affordable units, supportive housing, and market rate development. So, that's something I think our community continues to look to invest in to increase housing. Second is an outcome-focused response. So when I talk about the HBNL, the Homeless by Name list, that's exactly what they're talking about. So it's having robust data that shows you the issue in your community. It shows you how many folks you have experiencing homelessness at any given time, so that you can then connect them as quickly as possible to that housing that is available. And then the third piece of the third principle is around ensuring that you're focusing on those folks that have the highest barriers. So that's done in our community through the coordinated entry process. It's ensuring that we are connecting the folks with the highest vulnerability in our community to housing as quickly as possible. And the key really is the wraparound support that's mentioned there. And so through programs like permanent supportive housing, through rapid rehousing, it's not just getting people into housing. I think there oftentimes is a misconception around what housing first is, and that housing first is just you get them into housing and then you leave them. And it's not. It's you get them into housing without prerequisites, and then you provide them that intensive support. So that is something that is also emphasized by the Built for Zero model. So locally, as I mentioned, we have paired this model with this PHB strategic goal related to utilizing that model for families that are experiencing homelessness in our community. So through the HBNL process and through the coordinated entry assessment process, we're identifying households with children in our community that are experiencing chronic homelessness. An assessment is done, and then they're placed on the centralized wait list, which gets updated daily through that real-time HBNL data that we were speaking of. And then we have several different housing programs that work specifically with families. So our LTRA, or Long-Term Rent Assistance Program, prioritizes families. And then we have rapid rehousing programs and permanent supportive housing programs that also work specifically with families. So once a referral spot or a spot in one of those programs comes open, they reach out to our coordinated entry team. We immediately have a name of a head of a household that we can send to that program to get them connected as quickly as possible. So what we have seen in the last probably 6 months or so of really hyper-focusing on utilizing this model, we have been able to connect households experiencing chronic homelessness that have children with a housing program within 21 days of them being added to the centralized wait list, which is an incredibly quick turnaround. built for zero. The idea of the zero is what's called functional zero. It's the idea that you're housing people that are entering into homelessness. You're getting them connected to housing quickly, and you're reaching kind of a level of at the time they're entering into homelessness, they're getting connected to housing, and so there's that ongoing kind of cycle of connection. And 21 days is incredibly quick. When we talk about some of the bureaucracy with some of these other programs and how long those can take, this has been really impressive. One of the keys to that success is a monthly case conferencing meeting, which is facilitated by our staff, which is attended by a myriad of providers in our community that work with families. And they are talking about those individual families that are on the centralized wait list to identify what barriers they have, what service needs they may have. Potentially there could be served by diversion really quickly, or potentially they need more intensive supports like PSH. But that's really the mechanism that we're utilizing to connect folks. And then going back to that first slide, it's been critical to pair these households with the LTRA program. So, it's just showing that if you have housing available in a community, you have resources to support those households, you can quickly connect them to those services. You're going to see a reduction in the number of households that are experiencing homelessness. I think it's also notable to just mention we recently completed a gaps analysis for households with children in our community to see what needs are arising for them, and primarily it was things like flexible funds to be able to assist them, similar to diversion, but sometimes even more flexible. And so we're exploring ways to increase access to those services as well. But we're excited to see that this model has shown success, and we will continue to implement it, and hopefully, be able to move from family households to utilizing this same model with other populations. It's similar, Commissioner Farr, when you to the veteran homelessness project of several years ago, of focusing on a population and really providing those intensive services. So I think it really used that experience as part of the influence for this as well. But we'll continue to monitor it and see how we can continue to add to the success of the program, but we're excited with the data that we've seen so far.
And James, you mentioned the need for the flexible family funds, and the Human Services Commission just in their last meeting allocated $150,000 to help address that need. So that was very exciting to be able to progress on the gaps analysis that was created. Yeah. And I think what is very impressive, overarching umbrella across the different programs that you heard about is that we continue to create and move forward programs that work very well as we continue to focus on the data and make the needed changes. Our challenge with each and every one of these programs is the scale. And that we can serve a few folks who have the needs, but unfortunately not be able to meet the full need. And so that's where we continue to struggle as a system, as a whole, is not being able to scale the programs to the point where we're really effectively meeting the need within our community. And I know that's not a surprise to any of you.
Commissioner.
I'm going to address that directly. It's all a matter of scale, isn't it? Because we're certainly not addressing all the needs that we identified. But Victor, in 1995, I was sitting where you're sitting right now for the very first time. I was appointed by Ruth Bascom to the Human Services Commission. And Steve Manella was sitting right there. And newly appointed Commissioner Bobby Green was sitting right here. And we didn't even know how to address anything back then. Right now, what is happening, and I'm going to look directly at you, Liz Levin, about the presentation that you just made. What we're doing here, what you all are doing, is identifying bureaucracy at its root and at its ugliest face, and finding ways to banish bureaucracy. Liz, you're a shop of one, and look at all the work you're doing in a shop of one. It's amazing what we are doing to eliminate bureaucratic obstacles to providing the services to the people who need them. Yes, the scale is tremendous, and yes, the pipeline is growing and growing. But we're here at Lane County, I can attest to this, through 31 years of witnessing it, that it's never been done at this level before, that others wish they could do it at this level, and the reason we're able to is because of Liz and Victor and the work that you do on the ground. And I'm just pleased to be a fly on the wall watching you. I've used that term several times today because that's what I am quite often. I just get to try to help facilitate your work because you're the ones doing the work. And it's amazing. You're banishing bureaucracy and you're getting the services to the people who need them. So I'm just proud to be a tiny, tiny little part of that. And I hope everybody listening and everybody in this room understands how much Lane County is doing in the area of human services that other counties wish they were able to do.
Katrina and I were just sitting here wondering what we were doing in '95.
Well, we were building a large store out at Jerry's at the same time.
Go ahead, Commissioner Tree.
Do we have a sense yet, thank you for the presentation, and all of you, really. Do we have a sense yet what the impact, I imagine it's a little less on these programs than some of the others, but of the newer restriction, the fewer dollars and newer restrictions on how we can spend them as far as case management and having fewer shelter beds? We're getting incredible results, but I'm imagining a lot of these results haven't yet caught up with those impacts. Do we have a sense of that yet? The new state directives around limiting how we can spend the funds that we get, and
Yeah, just even regarding the outcomes that we are requesting from the agencies, we're to a point where we are expecting our shelters that are funded through the state, where we've received a significantly lesser amount of dollars, that there is a 10% expectation that their residents transition into permanent housing. And that is very low and a result of not having case managers and housing navigators to help the residents transition on. We've been fortunate in that there have been particularly behavioral health agencies that have been willing to partner with shelters and come in and provide a piece of that case management and housing navigation, which has been helpful. But we are absolutely seeing a reduced number of transitions of residents moving into permanent housing as a result of that funding reduction.
this is pretty immediate. So
It has been, yes, and where our outcomes are due today, and so we should in the next few weeks be able to see for this last fiscal year the overall outcome results, and we do expect that they will be notably less as far as transitioning residents into permanent housing.
And do we have, you brought your crystal ball with you, do we think that's going to get worse because of the sort of compounding effect of the bottlenecking of being able to move folks through the system? Or do we think sort of where it is now where we're going to be until we get more resources to bring back case management and housing navigation and more shelter beds?
Yeah, it's a great question. I think that whenever there are new housing opportunities that arise, there are kind of direct housing options that open up for residents. And so, for example, we know Square One will be opening up a housing complex in this next year, and that many of the folks transitioning into the small units will be from shelters, and so that will help and would be independent of whether there's case managers in the shelter. And so I think there are some positive things that are coming in this future fiscal year, and then we'll continue to have that challenging reality of not being able to work with folks to reduce their barriers and transition on.
Yeah, thank you. Thank you for that. Thank you, Chair.
Yeah. Okay. Well, greatly appreciated, everybody. Thanks for coming in this Wednesday morning.
Thanks for your time.
See you tomorrow.
See you there. Okay, thanks everybody. Next up, we have commissioner business to wrap up our Wednesday here. Do we have any announcements, comments, remonstrance?
I have,
Commissioner Trigger?
thank you, one announcement, which is just to remind folks that the Lane County Fair is next week, starting Wednesday, the 22nd through Sunday, the 26th, and atthefair.com has all the information you want. So Friday evening is the animal costumes in the barns. That is probably going to be my favorite thing. But if you want to ride a Ferris wheel or eat a corn dog or see some quilts or
We'll see Blue Oyster Cult.
any number of things, atthefair.com, starting Wednesday next week. And running through Sunday is my announcement. And I have a couple of other comments, but I can wait for those to come around.
Also Ned Ledoux on the 22nd. But do we have any others?
Well, to the,
It's not really an announcement, just as a comment, we lost 2 pillars of our community recently, Abraham Coulibaly and Marianne Malcolm. Many people know them. They have done a lot of fantastic work in our community, and they're huge loss. I know that Marianne Malcolm will be having a community celebration soon, and I expect a lot of people to be there. And awaiting if there will be a celebration of life for Abraham Coulibaly's. But I know a lot of people are doing an outpouring of support to their families. So I just want to acknowledge that loss for our community.
Okay, seeing no more, we'll do committee reports real quick.
I have another comment or remonstrance, less than a committee report.
Oh.
I don't know if you want to.
Yeah, slide it in.
We're just sort of mishing and mashing. I just wanted to acknowledge 2 things. One, I wanted to really thank our search and rescue volunteers. I don't see them often in my neighborhood, well within the city, but they were dispatched to help EPD search for a medically fragile elderly woman in my neighborhood recently. Had a really tragic outcome, not the one anyone wanted. But it was just so interesting to be driving into my neighborhood and see our search and rescue, see 4 folks with their SAR t-shirts and their radios combing through Amazon Park. So I immediately texted the sheriff to ask what was up. He was responsive. So just want to really appreciate they're such a important core of our when we give a more expansive understanding of what public safety means. Our search and rescue volunteers do a lot, and they're also often sent to really. It was July 5th and 6th when it was really hot, and they were out there in the afternoon. So they're often out there in conditions that are really challenging, doing really difficult work, and oftentimes with great result thanks to them, and sometimes with really tragic and sad endings like this case, but I wanted to thank them. And then I also wanted to thank the team at St. Vincent de Paul. I went on a tour, right, I meant to mention this when our homeless response folks were here, but it had been quite a while since I toured 310 and 410 Garfield, and then went out to the complex at 99 and learned, saw the Schleiz Center now that it's up and running for a while. And of course, Lindholm's been there forever, but also to see the Zone, which some of you might have gone to that open house when they purchased that property, but to hear more about and see the preparation for moving the Dawn to Dawn site over to a more hospitable place that's more integrated with the other services, and to see a bunch of the old pallet shelters that we were able to bring in back in the day, being ready, having the ground ready to repurpose those. So they're just doing phenomenal work over there. And I just wanted to give a shout out and appreciate the staff that spent so much time walking the various sites and chatting with me about their services. Thanks, Chair.
Yeah. Well, that brings up a great point. I want to thank our roads team. I came home the other day and it was one of the 90-degree days, and they were out crack sealing right in front of my house. And, it's tough work, and we just thank them for everything they do. And Lane County is very, I wouldn't say lucky, but we are to have the kind of roads we do have. And every now and then we get complaints of, why are you crack sealing? Why are you, rock sealing this road? And well, the road's in great shape because of our preventative maintenance. So just thank them for being out there in the heat and all the continued work they do to keep our roads drivable.
One of the first things you did was go on one of those cruises, I think, back in, I don't know, about 2014, didn't you? Yeah.
Highly encouraged. Yeah.
It's fun. It really is a great,
is
and the weather's usually fantastic.
Fog sealing, that's the term I was thinking. Fog sealing. Yeah, it is. And it's the smell of asphalt you love, if I recall.
Tillamook asphalt pavers all the way.
Calling the cologne guys, trying to make a cologne for you there, Commissioner.
I paved the road up to Mount Nebo. Up to the top.
Future board assignments or requests.
We've kind of been hopscotching around here. I've been trying to wait for my opportunity here about committee reports. I need to
Gotta
bring
keep up.
something before the board, and thank you, Director Moody, for joining us. She may be here for some questions. I want to revert back to my AOCC, the Association of Oregon California Counties request. We're coming up on an election deadline on Friday. And that election deadline basically is for the county to decide if they want to take timber receipts or SRS funds. So I want to give you a little bit of background of what's going on with that. There's obviously some still moving target changes. And as I said previously in the meeting, toward the end of the year, the federal administration is committed to tripling or even quadrupling our output for the ONC lands, which could change our future of our selections and our elections of taking SRS funds versus timber funds. So I want to run a few numbers by you. I don't want to confuse you with a lot of numbers, but I think it's one of those complex situations. Director Moody and I and Steve Adams were talking this morning that you have to have a little bit of understanding where things go and where we're at. There's 15 counties that are within the Association of Oregon Counties. At this juncture, 5 counties are better off taking timber receipts. 5 counties are better off taking SRS money, and 5 counties are kind of on the bubble. So that's kind of where we're at. Now, if you remember, as I said earlier, Lane County is the 3rd largest timber receipts recipient county of the Association of Oregon Counties. Our recipient number is 15.27%, which means our 75% share of receipts would be standing this last term at about $6.8 million. Our ONC and SRS payment would be sitting at about $3.4 million, and the Forest Service receipts, which all these funds are kind of different, is about $1.2 million. And then the forest SRS payment is $5.3 million. Now, all those numbers together basically equate to about $8.1 million in timber receipt money, versus right now we're still standing at $8.8 million in SRS money. So obviously the choice is right now for $500,000 difference, it would be to take our SRS selection election. Now the thing that the ONC and the folks in the timber industry and the federal government are still working in partnership with is to get the ONC counties funds out of the SRS money, which they're projecting at some point would put us at about 25% more money than what we're getting. This year's number would be, if it was out, if the ONC money was out of the SRS, we'd be getting about $12.1 million in receipts money. So we're right on the cusp there of some major changes happening that the next board is going to have to look at and keep abreast of on the changing landscape of the SRS continuations and the increase in timber production that would make our timber receipts more palatable to elect. So with that, if there's any other questions that you want to ask numbers-wise, if not, I'd like to get some head nods from the board here to authorize staff to better digest the data of this SRS versus timber receipts. And right now it looks like obviously the the SRS money is what we're going to be sticking with, and submit our vote to the Association of Oregon and California Counties so they can submit appropriately in a timely fashion the federal vote that is due on Friday. We don't have time to get a board order ready and run that through because we're going off for the next 4 weeks. So I want to get head nods to authorize staff to take care of that for us by the deadline on Friday. Did I miss anything? Go ahead.
Maybe I can maybe a little more just a little bit more history.
Go.
Because this is a thing that's existed since SRS began, that you have to make an election of whether you want SRS or you want timber receipts. So it is something that the county's done multiple times. We've typically done a board order. As mentioned, we don't have time to do that. The last couple renewals have just said, hey, we're going to assume that you're electing what you've always elected. That was the last couple renewals. This one said, we're going to assume that you're electing what you already elected for the first 2 years, and it's silent on this third year, which is the current budget year. So we received an email here very recently saying, hey, we've got a deadline, August 1st, we want to know what you elect. So as already stated, we've done the analysis that SRS is still better for us because the road fund gets such a large amount from SRS. You've heard me say during the budget process that the general fund actually does better with timber receipts and has even before this percentage change. Would have been better with timber receipts, but the county as a whole, we're looking at the county as a whole and all the funds that we receive. So
And we can't pick one, we can't take SRS for the road
Right.
fund, and that's one of the things we'd like to do is have the law change, take SRS in the road fund and timber receipts in the general fund.
Right.
We can't do that right now.
Yeah, because these ONC forests, as you all know, are very unique to this area of the country. It's just these counties, Oregon, California. And so ideally for us, it would be that that's not part of secure rural schools, that is, hey, let's just carve that out. But that's a national.
And for context, we budgeted the SRS receipts. So we've already budgeted in the adopted budget by the board the SRS receipts. We just need to take this action to notify them of our intent.
Yeah. So it'll be the U.S. Forest Service who will receive they're the ones requesting that we tell them what's our election.
And you said it was just for this year. We're hoping it's not going to automatically put us into a cycle where if the timber receipts take off like we hope, that the next year we don't have an option because we're stuck into a lane that we can't move our boat to timber receipts the next year.
But I'm understanding you said it used to be 3 and this year it was 2 and now you have to opt in for year 3. So do we just write the letter explicitly stating for this coming year? We just
We
write
could
the
say
letter
it that
saying
way.
we're opting in for this year to SRS.
Yes,
Right.
and that is the way the notice is.
Yeah.
It does say
Yes, this year.
federal fiscal year 2026. So I'm hoping that it will be if the legislation, if the public law says we're going to assume your election. So maybe conversation.
And so one of my questions is a sort of process question. Is this the kind of thing that would normally be noticed and have a board order? Will it come back as a sort of retroactive order on our consent calendar when we reconvene in August? Is that the fact that we didn't notice, is this a policy decision that we're making?
The county has historically done board orders. Like I said, we haven't had to make this election for a while.
Not as tight a deadline either.
Right.
We could do a retroactive. I suppose the way we could do it today is if we get head nods from commissioners on this action, then we could bring back on the consent.
Yeah. To have the record is helpful for future people to find as well.
Seems an easy decision to me.
Yep.
All right, super. Well done. Thank you for coming to help us out. Appreciate
And
that.
that's different, Commissioner, than the item you brought up, that we're still going to get more of an actual item back in a work session or report with
That
Mr.
item was
Adams.
about the litigation fund.
Right,
Totally
just to
different
make
item.
clear, just in case anybody's sort of half watching, tracking, this is different. Yeah.
Nobody half watches.
Nobody half watches.
Okay, thank you. Future board assignment requests.
Yeah,
Mr. Trigger.
thank you. Without objection, I'm hoping folks will support. I'd like to ask our Human Resources Director and County Administrator or their designees to review Lane Manual regarding the Board of County Commissioners oversight or determination when engaging with outside legal counsel, and to bring back options for language that could allow the board, give the board some options to have the right and authority to directly hire special counsel on matters related to employees that report to the board or manage other uniquely sensitive or complex personnel matters. That's why I'm asking for it to be the HR involvement.
What's the manual say now that is different than what we do now?
The board does not have initial or ultimate authority in
And that authority rests right now with whom?
Although this would be consistent with longstanding past practice where the board has engaged a special counsel for very specific items recently and going back several years. So this would potentially bring Lane Manual into alignment with what has been standard practice, but just isn't explicitly stated in Lane Manual.
Yeah.
I'm good with a discussion on that, so I can highlight what is being done and what historically has been done and what the potential is, what the options are. For the
Right now, the
future.
Lane Manual in Chapter 61 assigns that to me
Yeah.
in 4 different categories, and that's,
and again, shining a light on it and understanding what is practice and what manual states and what the options are for the future. I'm cool with that.
You wouldn't have, you specifically said HR director, you wouldn't have county
And
council.
county administrator or their designees, so if they,
But not county council involved in that?
if they wanted to designate or bring in support from the Office of County Council, and then in the discussion, there may be.
I think part of the
discussion.
issue is that the manual doesn't actually seem to contemplate if there's a conflict for the actual county council. So, and there are matters where the board may want to hire legal counsel where there's a conflict and all of the authority seems to rest with the county council. And so ensuring that the board has the ability to be the ultimate decider on those matters, just as you are with the role of the county administrator. I think that's the question, is just about the ensuring a check and balance there.
So there's a process.
Because we don't designate authority, it's just a given, and it's out of our hands. And that would be a difference, is to put that layer of an opportunity for us to have it in hand, and, yeah.
Council Bovet, you had something?
I was going to say, there's a process in Chapter 61 to deal with conflicts either for me or for the entire office, and I utilize that. It's A in that particular subsection. There's also another one, D, that I typically appoint special counsels under for their expertise. I've got about 4 special counsels for various expertise. So there's different processes and different standards in the Lane manual that tells me what to do. Ultimately, the board can overrule me on anything or do its own thing. Special counsel is a little different than county counsel, so you have the direct authority under statute and Lane manual to hire into my position, either temporary, interim, or permanent. But for special counsels, there's different categories that's currently spelled out. It's all baked in there.
And that would be, I imagine, part of the presentation.
I'd offer my head nod if council is involved in this discussion or their designee. That would make sense to me to have that with my council.
I think just an open discussion on what, and it's not just for today. I mean, this is for from this moment forward, for 10 years from now, and to look back on what is it that we are doing, and this would be a chance to really codify what it is the board, not this board, but all boards can do. So.
Yeah, part of the issues, there have been just inconsistency in the application of the existing manual, and so wanting, to make sure that there's clarity, that the board understands what the process is, and then that process is actually followed consistently.
And for transparency, for our sake, that we understand what are the limits of our authority and where have we ceded that through language in Lane manual.
I think your key word there is consistency.
Do I have a role as well?
Yeah.
I think, my assignment request was that because of the potential nature of conflict, that we say your designees, understanding that bringing someone in from the Office of County Council is absolutely available to you. But because it is specific potentially to personnel matters as it relates to employees that report to the board, my assignment request was that it be the HR director and county administrator or their designees. Not precluding, not denying any legal counsel, Office of Counsel involvement, but not explicitly stating it.
So I'm sorry, Commissioner Trigg, would you mind just kind of like, this is kind of a complex conversation we've just said, would you mind just kind of like contextualizing this request as different in like 2 sentences of where we're at and where you'd like to go? Is this just basically a discussion to have this discussion, or is it a direction that you want the board to kind of consider to change?
This would be information sharing, and then a conversation about what is the process, what has been practice, how does that align or is not consistent over time, and then, as is often the case, if we wanted to make any changes to Lane manual, that would be a policy decision that, as a result of that report back, we might direct.
So this is requesting a work session to explore this idea. Is that what this is?
We could, I don't know if we call it a work session but it's a report back of information. It's for staff to bring us back information about what is currently in the manual and what has been our practice, and any suggestions for language that would make it consistent.
HR director, county administrator to come back with this, or their
Yeah, or
designee.
their designees. which
And I
could-
said I would head nod if added to that was county council and or their designee.
Yeah, I would agree with that. I have some concerns about not putting the county council in that loop.
I'm in that same field because of this, because what we're looking for is consistency. Well, if this is all about achieving consistency, yes, let's do it, and let's use whatever resources we have to achieve that consistency, to define what we're doing. If there are some things that need to be adjusted, let's adjust them, and if not, let's just make sure that the future boards understand that this is the consistent way to appoint outside counsel. And I don't care how it's done, I do, but I don't care how it's done, as long as it's done consistently.
Can we say the office of county council?
Well, if I
So
said
that-
county council or their
That's
designee.
a person. Yeah.
I think I've been pretty consistent, and I follow the lane manual, at least I try to.
That's it, and that would be highlighted in this discussion, I suspect,
Well,
Rob.
not if I'm not a part of the discussion.
Well, and my point there is that who the part of the discussion needs to involve people who will help us achieve consistency, and no part of that is the current operators, the current technicians who do it. What have we been doing? How do we do it? And how will future boards continue to do it? So they're doing the same way every time. To me, it's not a matter of personality. It's not a matter of pitting any practice against another practice. It's a matter of just achieving consistency, and that's, if we can achieve that, then everybody should be happy. And if well, I'm not going to. Whoever is necessary to achieve that consistency in this conversation is how it should be handled. And so that's my goal. That's my head nod is, if this is to achieve consistency. If it's something else, forget me. I'm not a part of it.
Yeah, well, it is absolutely to achieve consistency, and also for the board to understand the limits or opportunities of what is our authority when it comes to certain matters that involve positions that, leadership positions in the organization, because that's why I asked for HR to be involved, because it's specifically around complex personnel matters or other uniquely sensitive matters, and it is about outside, who has the authority to engage outside counsel. Currently, this board, even though we are the deciders of this organization, do not currently have explicit authority as deciders in that matter. And so it's just a presentation on what does Lane Manual say now, what has past practice historically been, are there any opportunities or changes we would like to see made to that? That's the ask.
To eliminate ad hoc actions by future boards, absolutely, I'm
Yep.
all for it.
Okay, great, thank you.
You want to read that back?
Well, what I have, Commissioner Trieger's request is to have Human Resources, County Administrator, and County Council to review the Lane Manual, Chapter 61, regarding, specifically regarding board oversight on outside legal counsel, and bring back a discussion to ensure consistency in the process and address any conflicts of interest.
Sounds good. Any other business? Yes.
Thank you, Chair. I'd like to also suggest and get head nods for a future board assignment. We had the contractors that came into our sessions yesterday and had some concerns about the CMGC process and open bid process. And I'd like to just explore, we had said to them, and we're talking in the moment about having some future work session, and so I'd like to put that on the board if I can get some head nods, just basically direct staff to schedule a work session with our capital improvement and procurement team and the local contractors to better understand, define, and establish a clear vision to how we can better help our local contractor firms succeed via either the CMGC process or the open bid process.
Yeah, and I'll just say, when I met with David and Sean Hubble, they were on board with this. They want this to happen.
It's interesting that did all of us meet with those two at some point along the way? That was
did.
great. I thought that was really good information.
Yeah, because we were
Very
getting so many
insightful.
emails, I
Right,
asked
yeah,
to better understand. My only question is, how is that, because that doesn't seem like a board work session. My understanding was that staff was already planning to pull it together conversations, feedback, learn, and then they might bring something back to us as a result of that, but that's already underway.
I didn't
rather
get
than a
that
board,
sense,
because
that
there's not a.
session.
that's
If it
what
is
I heard.
underway, that would be a parallel to what you're asking for. so-
Right, but I didn't get the impression that it was already underway, that it was just suggested that it could be underway.
Well, let's
This is-
ask them.
This is to assure.
Yeah, I want to make sure it happens.
So I guess I'm asking, would it be a board item, or it's, to me, that seems like staff work at first, and then if staff wants to bring it back to us because there's some policy decisions around how we do contracting, that's where that happens.
However the process works out, I just want us to, I mean, I think we put a commitment forward
Yeah.
to them in the moment, and I would just want to honor our commitment
I'm
to
with
those.
that, yes, absolutely.
Yeah, so just
there's
affirm.
clarity on that, on how it does happen. And,
I'm with you a little bit.
are you clear?
You're me a little bit. Okay, I was like, I wired Commissioner Lovell asked for a work session.
Right.
With our capital improvements team to talk about the vision and ways in which we can support local contractors, understanding the CMGC process and competitive bidding. So is it a work session? Is that what the head nods are for? Or is it directing staff to look at the current process and identify solutions and then bring that back to the board?
Personally, I think it's having
ma'am.
you affirm with staff that they are planning to
Yeah.
bring, to create some opportunities for contractors to have some roundtable conversations around process, give their input, and then for the staff to bring back to us.
Bring back the discussion after
how
they've
that
already
went.
talked, okay,
Yeah,
all right.
right?
So we will bring a work session back to the
That
board
fits.
after the staff has worked with
Right.
the local construction community to figure out some solutions, so hopefully there's some
Yeah.
solutions put on the table for you.
Great.
Yeah.
Thank you.
I like that. Okay.
Do you like that, Rob? Okay.
Why not? All right, so Pat's gonna love this. I'm gonna re-adjourn us. All right, we'll be back Tuesday, 18th. This is not considered a break. We're just not. August 18th, and please reach out to us if you need anything.
This is Staff
everybody.
in Service Month, right?
Yeah.
Thank you.
Certainly, yeah.